I'm Ruth Kitzmiller. I'm a consultant at Creative Healthcare Management. I have been with Creative Healthcare Management for about 2 years now. I bring to Creative Healthcare Management over 30 years of nursing experience from a large healthcare setting. My former organization was 9 hospitals, and they varied from critical access hospital to the largest hospital being over 340 beds. I've had a variety of roles in my nursing career. I worked as a floor nurse. I worked in the operating room. I did some purchasing work for a while. I was a risk manager and safety officer, so I have that fun background as well. I was a director of surgical services, and I actually led an EMR project that we went from one EMR to another, and I was the clinical director for that. So creating new things in an EMR, meeting with staff, meeting directors, really finding out what it was that they wanted out of the EMR so it would work best for them. And then my final position at that healthcare organization was the Magnet Program Director, where I had the privilege of really organizing, orchestrating our journey to excellence and keeping everybody informed, leading the program, to make sure that we were on track and we could get all of our hospitals designated, in which we did get our largest organization designated before I left the organization and took on this new role with Creative Healthcare Management. As the Magnet Program Director for a large health system, I was looking for someone to help me on this journey to excellence in Magnet designation. So I interviewed a variety of organizations to find out which organization was the best fit for us. The organization that I worked for was in rural Michigan. It was in the middle of the state to the northern part of the state. So it was pretty rural. So we wanted someone that could help us with small town, small hospitals, and understood really where we were coming from on this journey. It was a big lift. It was a big program to institute and get running and have all the pieces going. So we wanted someone who would understand our resources that we had in our program and how we would be able to accomplish what we wanted to. So after several interviews, and actually I was at the Magnet conference and interviewing folks and interviewing the different companies, got literature and went back and really interviewed them some more. I put these organizations through another set of interviews with not just me, but a couple of the directors at the hospital. And we landed on Creative Healthcare Management and using them. We had used some of their services for launching relationship-based care and reigniting the spirit of caring. So we were familiar with the small company and all of the resources that they brought. So that's how I got connected with Creative Healthcare Management. And then after we were designated, really Jen Guanci, the CEO now, she reached out to me and she said, "Hey, Ruth, I think you have great project management skills. You did a great job leading your organization to a magnet designation. So would you consider working for us? Would you consider coming and helping more organizations achieve magnet designation?" So I did. I took a leap, and here I am. I am helping organizations all across the world. I've had workshops with an organization in Qatar. I've traveled throughout the US, Texas, Washington, Florida, Rhode Island. So really reaching so many more people now and sharing my experience with Magnet, sharing my expertise, and helping as many folks as possible go on a Magnet journey or even a pathway to excellence journey. Whichever one is right for your organization, we really have the skills and resources to help you with that. In the Cultures of Excellence service line at Creative Healthcare Management, we specialize in helping organizations on their journeys to excellence. Again, it can be magnet, it can be pathways, it can be any award really that you're working towards. So we like to begin with an assessment. We will come into your organization, we'll talk to leaders, we'll talk to staff, we'll find out exactly where you're at in your journey to excellence, and then we make recommendations. If you need some help with shared governance, then we have a skill set that can help you create your shared governance structure. We can look at strategic planning with you. What goals do you want to set for your unit-based councils, your hospital councils, or maybe you're part of a system and you have some system councils as well. So we can help with shared governance. We can help with writing. If you're writing to the magnet standards or the pathway to excellence elements of performance, we have writing workshops. We offer public workshops, and we also offer organization specific workshops where we'll come to your organization and teach your staff right on site with you. So we help folks learn the basics of writing. You learn how to break down those sources of evidence or those elements of performance, look at each little piece of it and what they are asking for. We help you with data. Data is such an important piece of our work. It really should drive the work that we do in unit-based councils, in our organizations, in our units, really looking at data, digging down, how are you doing with falls? How are you doing with patient experience? All those things that nurses influence on a daily basis, really understanding it, getting it to the staff level, because those are really the folks who influence that data. Data is the signature of the work that's being done on your unit. So if we can help the clinical staff understand that and help the managers and leaders understand to the next level, then that helps with that goal setting, with action planning, all a part of strategic planning, which we can assist you with as well. And as we go through and as you go on your journey, we can help you all along the way. Like I said, we can help you get ready for the Pathway to Excellence survey. What tips and hints have we learned over the years that will help you have a successful survey, help you have as high to 100% participation as we can get, so that you have good results. If you're on a magnet journey, we'll help you prep for a site visit. Not only do we help you do the documents that you submit, but let's say you get additional documentation requests, we can help you with that as well. We'll help you with site visit. We have some clients that even will ask us to be on site with them just for moral support. We're in the command center cheering them on and helping them through the site visit, which can be very stressful. And then afterwards, we can help you with a year after plan. Again, more strategic planning, more how do we celebrate? I mean, that's the funnest part of this job is helping people figure out how to celebrate, which should be done at all stages of a journey to excellence. Our team has over 50 years of experience with this. And so, yeah, we always say you don't get just one consultant when you consult with Cultures of Excellence, but you get all five. And we talk to each other on a daily basis. We bring our expertise. We bounce ideas off from each other. If there's a story that our client's writing, we're not quite sure it meets the standards, then we'll just touch base with each other. We'll talk to each other. So again, you don't get just one consultant when you contract with Cultures of Excellence, but you get all five and our expertise.